Welcome to Regina's Corner. My name is Regina Marks, and my guest today is Yasmina Cheeseman. I want to make sure I say it just right. Beautiful name, isn't it? She is a physician assistant, board certified, and she's going to tell us a lot about geriatric care.
All right, well, thank you very much for having me.
You are welcome. Thank you.
Yes,
Yeah.
I see this as another avenue for us to be a good community and share knowledge and support each other. Okay?
Absolutely. Thank you.
Thank you for having me. So, first thing, let's address what is the geriatric age?
Okay.
Right, 65.
Okay.
65, that's right. So
Okay.
you got time.
Okay. I was joking with her earlier. I'm like, I want to know this question because I'm going to be 58 in February, so I just wanted to make sure I hadn't arrived yet.
Yes. Yes. So there are a lot of reasons why a geriatric patient should definitely be seen by a provider on a regular basis and not ignore anything.
Okay.
So first one is preventative care, right? So an example of that would be immunizations.
Okay.
Every year we hear about geriatric patients dying from the flu.
That's true.
Very sad. And it's very simple and easy to get that yearly flu shot that provides protection. Not just flu, but pneumonia, for example. Or as our boosters start expiring, getting a second booster so that our bodies are better equipped to fight infections.
Okay.
Simple and easy way to protect ourselves. Now, second reason would be to diagnose diseases earlier. If it's something like cancer,
Right.
so it's important for patients to undergo colonoscopies and mammograms and blood tests that are necessary.
Right.
The earlier detection of cancer, the better prognosis
True.
and easier treatment, better chances.
Absolutely. I was talking to her about this earlier, that my grandmother had cancer, but she hid it from us for a few years. And so we've seen different signs of her kind of moaning and groaning, and she was like, I'm okay. So I guess I want to say that, because by the time we said, okay, you're going, and it was too late. So make sure that you're paying attention to your bodies. Be honest with your physician or your healthcare provider. And be honest with your family, and family, keep your eyes.
Absolutely.
Keep your eyes on your family member. Yeah.
Absolutely. And another thing with geriatric patients is that they don't always present like a younger patient would. So something like a urinary tract infection in a 20-year-old. 20-year-old will have a lot of pain, will have urinary frequency, will be able to verbalize what's happening. And as the infection ascends, will have fever, increased white cell count, all of that. Your geriatric patients may just have a slight change, slight increase in urination.
Okay.
Or there might be a little bit of confusion. So please don't ignore it if you notice that in your loved one, because it can mean the difference between treating a simple urinary tract infection or them, God forbid, developing sepsis or a really bad infection that can cause them their life.
Right. Tell us what septic is.
Sepsis. So that would be where the bacterial infection infects the entire body. And so that is a very, very serious infection, very difficult to treat. Yeah.
Yeah, because it can travel throughout your entire body. So that infection, once it sits there, just like, let me live some other places.
Yeah.
And before you know it, it can be very bad and fatal.
Absolutely.
Yeah.
Absolutely. Another reason for early detection for something like dementia would be to put into place interventions early on to slow down the progression. So that means coaching the patient for cognitive exercise, exercising the brain, not just doing passive activities. Physical exercise is helpful, social engagement, as well as appropriate medications when needed. Now, when you combine all that, It can definitely slow down the progression of dementia.
Okay.
And so, if I have a choice to end up with end stage dementia 7 years from now, or 8, 9, 10 years, I would pick the latter one, right?
Right.
And that means, a couple more years of good quality life.
Right. True.
That's a blessing,
True.
right?
Yes, true. That is true. I'm sorry, I'm just thinking about so much of this. It's so important to follow up and get the care that you need.
Yeah.
Absolutely. Is there anything else that you want to tell our community?
Yes, I would say definitely look at the medications for the elderly patients. So by the time we are seasoned, as I like to say, at 65,
That sounds great.
we have potentially seen a cardiologist who has added a medicine. A rheumatologist maybe added a medicine. This doctor, that doctor. Now we are on 10, 15 medications. They start interacting. Now, what you needed at 55, you may not need at 75.
And what do you mean where they start interacting with one another?
So, meaning that one may block the benefit of the other, or one may cause an adverse reaction, a bad side effect when it's taken with another medicine.
Absolutely.
Right?
Right.
So it's important for our geriatric population to have that reviewed and to remove what is not essential.
Okay.
Right?
It's not needed at that time.
Not needed at that time. There certainly was a good need for it 10 years ago, maybe,
Right. Absolutely.
but not right now.
Absolutely.
Or another thing that I've seen is kidney function has changed over the last 15 years.
Absolutely.
You still need that medicine, but we must give a lower dose.
Right.
Or maybe give a cousin medicine.
Yeah, I love that. I love the way you said that.
Yeah.
That's so true. This is really good. This is really good information because, again, you need the community working together. In other words, the healthcare provider, you have the patient and patient's family to be able to sometimes kind of help, encourage. Yes, my mom is dealing with this. Mom, tell them, let them know that you are, so that the healthcare provider can be in tune with what's needed at that time and maybe what needs an expiration date, so to speak, of medication.
Yeah.
Yeah.
Good.
Yeah. Anything else you can think of right now? I have some questions, but
Okay. No, other than probably the best easy recommendations would be to eat well. It's important to pay attention to what we put into ourselves.
absolutely.
And then to exercise, because that helps the entire body. And like we discussed earlier, it's important not to do improper exercises.
Absolutely. We had a discussion about that before because, you can't get out there and run around the mountain, but talk to your doctor. They can actually tell you some things you can do sitting down and actually unique things that you can do with a towel, just to be able to wrap that towel around and lift it up and bend over back and forth. So there's a lot of things you can do, sitting down and, and if you are in a position where you are riding your bike, some people can ride bikes or go walking with friends. I see a lot of walking in the malls.
Yes.
For the malls actually open up. That's pretty cool. And just getting some exercise, but check with your doctor first on what you're able to do so that for you're safe and you won't injure yourself.
Yep.
Something else that we had talked about, and that is we're seeing more where healthcare providers can come to the homes.
Yes, that is a beautiful option if, say, the patient had a stroke, cannot drive, or the vision is gone. Instead of taking that, being dependent on someone else, the provider can come into the house.
Okay.
This works really well for demented patients.
Yes.
If we take them out of their familiar environment, they can become more confused, agitated. So it's much better for them to keep them in the house.
Absolutely.
And have the provider come to them.
Yeah, make them more comfortable.
Yes.
That's good. Yeah, I really appreciate that because a lot of times I think that elderly people really feel better in their home. I think the older they get, they just kind of feel better with surroundings of comfort and then having someone to come to the home.
Yeah.
Especially when the weather gets bad. It's rainy, it's icy outside, and
Yeah.
even if somebody's going to pick them up,
Still.
if they've fallen, they're like, no, I'm just going to stay here. So it's good for you to know that because sometimes you know, you may say, I can't get they need to go to the doctor and I can't get my grandmother to go to the doctor. I don't know what I'm going to do.
Right.
Then here's some resources. We can come to you.
Absolutely.
Yeah, that's right.
Yeah.
Good.
Yeah, and not just the provider, but say they need physical therapy to strengthen the muscles or work on balance, or occupational therapy to look at the dangers in the home. All of that
Absolutely.
can be ordered to come to
That's
the
cool.
patient.
That's cool. I
Yeah.
love it.
Yes.
I love it. Is there anything else you can think of you want to tell our community that's listening out there?
I would say, you know, if anyone is overwhelmed with medications, that is another avenue to explore your support options. So we can order a home health nurse to come into the home and work with the patient. You need to take this medicine in the morning, and this is what it's for, versus the other medicine, which is for XYZ, you need to take it after lunch. It's not always enough time at a provider's visit to go
Sure.
through that.
15 minutes.
Yeah.
Yeah.
Yes. So, you know, having someone come into the home again, or
Yes.
even meeting a nurse in an outpatient setting to talk about it and have a plan
Awesome.
can be very helpful.
That's awesome. Well, thank you so much,
so
and thank you
welcome.
for what you do for geriatric patients, and I can tell you're good at it.
Thank you.
And that's a plus when somebody doesn't mind explaining to you something, walking you through. So again, your healthcare provider may be a physician assistant, a nurse practitioner, or internist. Talk to them. And lots of times get together with your family and kind of get together to get that geriatric patient into care. And sometimes you might have to give a little tough love because depending on, they don't want nobody to know, and they may have fears. And it may not even be anything seriously like, oh, they just need to be treated for urinary tract infection, because they're confused, everybody is worried, everybody's concerned. Get the information. Knowledge is power, and also knowledge can prevent some things, just having knowledge, asking questions. So you're not alone.
No.
You're not alone, and you can get some health care. So I can go on and move into my season age.
Season age, that's right.
And not have to worry. There's I can't talk right now, but there's help there.
Yeah.
So,
Yeah.
all right. Thank you. We're going to do a part 2 on this because there's a lot of more information, a lot of more wealth inside of this wonderful human being here. And we're just been chatting. I'm like, really? Oh my, I didn't know that. So we're coming back again to talk about more geriatric care. And if you have any questions, please feel free to actually comment. Any concerns that you may have, we can direct you and encourage you to go in the right direction. Thank you for stopping by. We'll see you next time. Don't forget to subscribe, hit the like button, hit the bell. Thank you.
All right.
See you
Thank you.
soon.
Bye.
Bye-bye.